Welcome to the Atrium Health Suicide Prevention Community event. My name is Martha Whitecotton and I'm the Senior Vice President for Atrium Health Behavioral Health Services. And we are grateful that you made the choice to join us today. Suicide is the 10th leading cause of death in the United States. Even more alarming, it is the second leading cause of death for those ages 10 to 34. The rate of suicide in this country continues to grow. It grew 35% in the last 10 years. Self-inflicted injury is the cause of close to 500,000 visits to the emergency rooms across the United States annually. These statistics are sobering. And now we're in the midst of a pandemic, and coupled with the uncertainty and the fear relative to COVID-19, this pandemic is accompanied by economic failure, widespread unemployment, social upheaval, and unprecedented social isolation. Throughout history, events like this have contributed to a corresponding increase in suicide rates. Are we, as a community, ready for that? The expertise on this panel will guide you today and will help to prepare us as a healthcare community for that response. Kicking off our programming today is Calvin Harvell, and he will be telling you his remarkable story.
Renee and I were a young couple. Renee was a bright, beautiful lady. She was a nurse. Renee ended up taking her life one afternoon. That changed my life forever. Suicide is just so painful. The unanswered questions and, did I say something wrong? Did I hear something? Did I miss something? And before long, I found myself in the middle of an addiction. I lost my father and two brothers to the addiction of alcoholism. They all died of that. In my life, I just didn't want to do it anymore. I just wanted the pain to stop. Somehow or another, if there was a button I could press and I could go to sleep and not wake up for a while, I would try to drink myself to death, hoping that, I wouldn't wake up. And that went on for a long, long time. Everything is temporary, but suicide is permanent to just a small temporary problem. And if we can get through that problem by talking, by listening, by hugging, by touching hands, going for a walk, that will pass. And if that can pass, you can walk through anything. And that's what I share with people. Let's just go through the day here. And let's see how we end and feel at the end of the day. And let's do this again tomorrow. But let's just live today. One day at a time, to me, sometimes is just simply understanding life is good for me today. The pain and the grief and all that stuff, I truly believe I've learned in my recovery is I had to do that to get to where I'm at today. I have two beautiful grandkids. They are just such a joy to my life. So all that pain has brought me to this side where I can sit with another individual that might be in that pain themselves and say, you know what? I went through that pain. It was tough, but I got past it. And my life today is I'm full of gratitude. The fact that I can be here with you today. There is hope. No matter what you've been through or where you're going or what you're going through, that if you get on the other side of it, you can have a life that you can't even dream about. Suicide is not the answer.
Hi everyone, I'm Calvin Harvell. I'm a North Carolina peer support specialist. I'm grateful and I'm humbled to be here with you today. It's an amazing journey that started off, I'm not even sure how many years ago, but I want to thank the people that believed in me and the ones that trusted what I was going to do. Joining Behavioral Health Atrium has changed my life totally. What I'm about to share with you a little bit today is not about me. I share this for the sick and suffering that are still out there, that they too might find some hope today in what we're sharing with you all. The video is part of my journey back. It was very dark. and the addiction had taken over my life, and I wasn't really sure I could ever get back again. You know, suicide is so painful for everybody involved. I will not sugarcoat talking about suicide today. It's unbearable. The pain will it'll rock your soul. It'll break your heart, but there is hope. Today I'm in long-term recovery. I'm a peer support at Behavioral Health, Atrium Health in Charlotte. It's an amazing journey. I work in the emergency room. We call it the ED. I will say that Atrium Health is not my life, but Atrium Health has given me a life in my recovery today to be able to service and help other people. That's how recovery works. Atrium Health believes in peer support. Today we have peer supports on the inpatient unit. Linda's up on South, Greg's over on North. Throughout the whole system, you will find peer support, which is absolutely amazing. I'll say it again. Atrium Health believes in peer support, and I'm proud of that part. Because of my lived experience and my past history of substance abuse, as well as mental wellness, and I say wellness because I do not like the word illness, I try to meet our people when they get here where they're at. I say our people because there's no longer those people. We've learned that any time, any place, any one of us can become sick. So we're all in this together. We also know the crisis started way before they got to the ED. So if we can meet them where they're at, we can give them hope for the process of healing to start. And for us to be part of that healing process, to see the changes that happen in people's faces and lives is absolutely an amazing thing for me today. We don't look at our people as being broken, but rather they just need help along their walk and their recovery, their journey. And that's what we're there for. I always tell people, we're always going to be here for you if you need us. We're always going to be here. Being able to listen without judgment, just being there. Just being there if they need something or maybe need nothing. Even if it's the smallest thing, like something to write with, a piece of paper, or even a pack of ketchup. I've witnessed a peanut butter jelly sandwich change attitudes, put smiles on faces. That's what we do. We help change lives. I've been able to sit on the floor with people before, just being there, being present. That makes a difference in how their day is going to be. Being able to share my story, my experience of surviving when it's needed. Being able to share and living in the moments of the here and now, not 2 or 3 days from now or a week from now, but right here, right now. I'm an advocate for all, from the 5-year-olds to the seniors and to the families. Sometimes we are the voice of the unspoken, and sometimes we're steady. Sometimes we're the steady hand with the shaking hand, and sometimes we're just that small light that somebody might need to find the hope in the darkness. But the most important thing of all that we are is we try to bring hope for the hopeless all the time. The seed of hope and recovery will be planted if you come to our hospital. A lot of work goes on at Atrium Health, and it's being done right now to save lives. Kate's Zero Suicide Program, the Mental Health First Aid Program, the Atrium Health Helpline. It's an amazing program. We're all here today. We're all we have is each other, and yet we're here today together. Even through this COVID thing, we can still be here together. I'm going to close with this a little bit. If there's anyone out there right now that is scared, doesn't know what to do, doesn't know what to say, doesn't know where to go, call us at our Atrium Health line. It's an easy number if I can remember it. It's 704. It's 444-2400. We can help. We can be there. Again, if you know somebody that's scared or doesn't know where to go and what to do, call us today. 704-444-2400. We'll be there. We'll be there. We'll answer the phone. I want to thank you all for being part of my journey here today. And thank you. I do hope to see you all somewhere soon and safe. Thank you.
Thank you, Calvin. That's your story is always so inspiring and amazing to me and all of our teammates at Atrium Health, and I think we get way more from you than we give to you. But thank you so much for sharing that. So I am Wayne Sparks. I'm the Senior Medical Director for the Behavioral Health Service Line at Atrium Health, and I'll go into some of the signs and symptoms of potential suicide or suicidal behaviors. Some of which are maybe a little bit less obvious than others. So some of the warning signs that are generally fairly easy to see, think about what somebody's saying. Are they talking about death, wanting to die, or wanting to kill themselves? Are they talking about feeling empty, hopeless, or having no reason to live, or that others would be better off without them? Do they talk about feeling trapped or just feeling like there's no solutions? Do they mention feeling guilt or shame or being a burden to other people? Some of the behaviors that you should be aware of, the behaviors may signal an increased risk, especially if it's related or around a painful event or a loss or any kind of significant emotional change. Those behaviors are typically around increased use of alcohol or drugs, changes in eating habits, showing rage or talking about seeking revenge, taking great risks that could lead to death, such as driving extremely fast or other uncharacteristically reckless behaviors. Showing a disinterest in maintaining their personal hygiene or their appearance when they ordinarily would not be that way. And then extreme or chronic fatigue is another big one. One of the most significant, I think, is making preparations, visiting or calling people to say goodbye, giving away important or prized items, putting their affairs in order or making a will. Those are signs to be aware of. And then the mood. People who are considering suicide are often displaying one or more of the moods of depression or anxiety, loss of interest, irritability, agitation or anger, humiliation and shame, and then displaying some extreme mood swings. And then another key factor is the relief or a sudden improvement. And I'll speak about that in a bit. While those are less obvious, those are more obvious suicide signs, there are some signs that are easy to miss, even with people that are close to the person that may be feeling this way. Here are like 5 signs that you need to know about and that could indicate someone is thinking about suicide. One of those I mentioned is moods, and the key factor is an unusual change in behavior. This is common for someone who is suicidal, but it's often easy to overlook because the changes may not seem related to depression or hopelessness. For instance, someone you know who is usually kind may become angry or aggressive. For someone who's been sad and struggling with depression, may suddenly seem calm and happy and at peace. Those are definite warning signs. The next is making a plan and accessing lethal means. This sign can potentially be obvious, such as if a loved one tells you they've recently purchased a gun. However, some of those signs are not as obvious. Gathering lethal means doesn't always show itself. Someone may be starting to stockpile pills without anyone noticing, and pills are easy to hide. It's important to be aware of any lethal means that someone may have access to. And we know that with access to lethal means, the risk of suicide goes up. The next sign is emotional distance. Someone who's feeling suicidal may become detached from life in general or from people or activities. They may seem emotionally distant from people, whether they've isolated themselves or not, such as acting indifferent in the face of an emotional situation, which may not seem like a suicidal behavior, but it is important to note this kind of behavior and recognize that as a warning sign of depression. Along those lines, someone feeling suicidal may lose interest in normal activities, work, home, and things that they once enjoyed. The next big category is the change in sleeping patterns. A shift in how someone sleeps is definitely a sign of depression, but also can be a sign of suicidal behaviors. Someone is feeling suicidal may sleep more than normal and then have a trouble getting out of bed, or they may sleep less and have significant insomnia and then feel overly fatigued and struggling the next day. Whether it's a symptom of suicide or not, these are symptoms that can of changes in sleeping habits and can be a cause for concern. My last one is the physical pain. Physical pain and discomfort are often overlooked as a symptom of depression and also of suicide. If someone you know is complaining often of any type of pain, like headaches or digestive upset or just general body pain, be alert to other signs of depression or suicide. If the individual has no easy explanation for that pain, such as a history of migraines or an athletic injury, you should be especially concerned. And while it can be difficult to know someone's intentions, there are often these warning signs that should get our attention, and then we can intervene. I'll now turn it over to Dr. James Rochelle, who'll go into some of the things that you can do. Thank you.
Good afternoon. My name is James Rochelle. I'm the Senior Academic Chairman for the Department of Psychiatry. I want to talk a little bit about some things we can do to help prevent suicide. Pre-COVID, suicide was the 10th leading cause of death in the world, and we've lost 129 Americans a day to suicide. Due to the economic downturn of COVID-19, we are now estimating an additional 75,000 deaths by 2029 from suicide and substance use. We have seen an increase in depressive and anxiety symptoms going from 8% to 31% compared to this time last year, which has really been attributed to COVID and the associated changes in people's lives from social distancing and the economic impact. 95% of Americans said they would do something if someone close to them was thinking about suicide, but 69% noted barriers, including not knowing what to say or lacking knowledge or comfort with the topic, prevented them. On New Year's Day 2018, I lost a family member to suicide. In my 15 years of practicing psychiatry, I have never lost a patient that was in my direct care to suicide. However, barriers that often stand in the way of people receiving care for depression and suicidal thoughts ultimately cost the life of someone close to me. Stigma continues to be a major barrier. Those that receive care for behavioral health issues are often stigmatized by others out of misunderstanding and fear. Our behavioral health care consumers may be called names or ostracized. Even the people caring for this group can be guilty of inadvertently creating barriers through their own biases and limitations. The person close to me, for the most part, refused care for this reason and did not allow family members to discuss concerns with others. This isolated both he and them and prevented anyone from being able to reach and get help. Despite having many resources, obstacles prevented him from accessing care that could have prevented tragedy. Having an open and honest conversation about behavioral health and its importance at work or at home is critical to decreasing stigma. It creates a comfort level with topics and makes it okay to discuss how one is truly doing. Also, making sure we are empathic and discussing behavioral health is essential. Enrolling in behavioral health awareness classes like mental health first aid helps having meaningful conversations easier. Just asking a colleague a simple question, "How are you doing?" breaks down barriers and shows concern. On the days leading up to my family member's death, there was clear signs that he was suicidal. He attempted to jump off a bridge on one occasion, but stopped himself. He had talked of suicide to his friends. His friends could have stopped and talked to him. They could have called his family, or they could have called law enforcement. But because of either not knowing what to do or not feeling it was their place, they did nothing. Had they intervened, I believe he would likely be here today. Research has repeatedly shown that if you ask someone if they're thinking of killing themselves, you will not be giving them suicidal thoughts. They are more likely to tell you that they're suicidal. Asking someone if they're having thoughts of suicide can be scary and at times can actually cause feelings of anger in the person asking. It's important to be aware of the feelings of fear and anger you may be having so that you can ask a question in an open and non-judgmental way. If someone reports they're having thoughts to kill themselves, it is important to take thoughts seriously and not dismiss them. Understanding resources in your community can help give a feeling of strength when you're talking to someone in crisis. Knowing the numbers to the suicide hotlines could provide options when you or someone you know needs help. Lastly, calling 911 and taking the person to the local hospital when someone reports suicidal thoughts may save their life. Just staying at someone's side when they are in distress may be the lifeline they need. Preventing suicide is everyone's responsibility.
Thank you, Dr. Rishal. Your words are very much appreciated. Good afternoon, everyone. I'm Dr. Rodney Villanueva. I'm one of the staff psychiatrists here at Behavioral Health Charlotte, and I also serve as the Associate Program Director of our Psychiatry Residency Program. And I'm here to talk about who's at risk for suicide, risk factors. Risk factors are those things that may place a person at increased chances for committing suicide. However, there is no exact one single cause for suicide. And in fact, there may be multiple factors coming into play that can lead a person to start thinking and contemplating suicide. And I'm here to talk about some of them. Some of them are very easily addressed, some of them are not. First of all, previous or current psychiatric conditions such as depression, anxiety, substance use disorders, all can contribute to suicide risk. There also may be certain personality traits that a patient may have, such as aggression, mood changes. Also, as I said earlier, anxiety disorders can contribute. We shouldn't also forget physical problems as a potential risk factor for suicide. For example, people who have chronic physical conditions, particularly chronic pain, may be at increased risk. Those who suffer from things such as head injuries, traumatic brain injuries, may also be at increased risk for suicide. There are also certain things in one's environment and in one's surroundings that can put them at risk for contemplating or following through with a suicide attempt. For example, any access to firearms or other lethal weapons is a risk factor. Prolonged stresses that a person may be undergoing, things like harassment, in our young people, bullying, relationship problems, financial distresses, unemployment, and also with COVID-19, we see prolonged isolation for others and social unrest as well. These are also risk factors for suicide. A person may be undergoing very stressful life events, things like divorce, financial difficulties, as I said before, and even significant transitions in their life. Also, those who identify as members of the LGBTQ community without support or who are struggling with their sexuality can be at increased risk for suicide. Trauma in the form of physical, emotional, and sexual trauma can also be another factor for suicide. We also must not forget family history. A family history of suicide attempts or completed suicide is a significant risk factor. As I said earlier, trauma, particularly childhood abuse or neglect, can be another risk factor. If a person has also had previous suicide attempts, this can also predispose them to a subsequent episode of suicidal ideation or completed suicide. So while most people are able to navigate their stresses, their difficulties with psychiatric illness well, it is important to understand that these things can contribute to a risk of suicide in individuals and to be aware of them. Thank you.
Thank you. Thank you, Dr. Villanueva. My name is Kate Penny. I'm a licensed clinical mental health counselor, and I'm the program coordinator of the Zero Suicide Initiative at Atrium Health. I want to start off today sharing a little bit about this initiative and why we decided to adopt this program and are so passionate about it. 83% of those who die by suicide have seen a healthcare provider in the year before their death. 83%. This is where we decided at Atrium Health that we needed to do something. We're a large healthcare organization. We touch people's lives daily, and we need to work to help people who are in need. Zero suicide is a system-wide, holistic change for our system. We are starting this work in our behavioral health service line. We plan to continue it and spread it throughout all of Atrium Health in the coming years. People always ask us, zero suicide, is that even attainable? We believe that it is, and there is no other alternative. There are different facets of this program to help our patients and to help our community members where they need the help. We knew that this work in suicide prevention was important, but over these past 6 months, where our worlds were changed drastically by COVID-19, we've realized how much more intensive and necessary this work is. People are more depressed, more anxious, not knowing what the future holds and when things will return to some type of normalcy. Two of the main elements of the Zero Suicide program are training and transition. Training our workforce to be confident and competent in suicide prevention and treatment. I know I didn't have a course in suicide-specific training in graduate school 20-something years ago. We've now developed a strategic plan to train our teammates. This past year, we trained everyone in CALM, counseling on access to lethal means. As you've heard Dr. Sparks and Dr. Rashal talk about keeping people away from their firearms, this training really helped me personally to understand gun ownership and how we can intervene in those few seconds. Like you heard Calvin speak about, if we can just do something in those minutes before someone acts, we can save lives. Our next training for all of our teammates beginning in November will be QPR. Some of you may be familiar with this. Question, persuade, refer. It'll be happening in November, and we're not just training our clinical staff, we're training our security officers, registrars, people who work in our cafeterias and our housekeeping, anyone who may come in contact with someone. It also helps our own teammates because we are all more anxious right now and dealing with personal crises. It's hard to ask these questions of people that we love or our coworkers, and this training will help us be able to do just that. Another element that I love about our Zero Suicide initiative is transition. This is helping our patients as they've gone through our hospital system, had their behavioral health care, and then they need to transition back home for their outpatient follow-up. We want to keep these people on the grid. The National Action Alliance for Suicide Prevention tells us that the transition from inpatient to outpatient behavioral health care is a critical period of time for individuals with a history of suicide risk and for the healthcare systems and providers who serve them. The risk of suicide in the 4 weeks after leaving inpatient behavioral health is 200 to 300 times greater than that of the general population, and it's highest in those first few days. That's where we want to connect with our patients. So what we do is when they're on the unit, we do a virtual meeting with them, talk face-to-face over the computer so they see and connect a face with a name. We then talk with them within 24 hours of their discharge, calling them to make sure that firearms are secure, there's no access to any lethal means, and that they're doing okay. We make sure that they know when their hospital follow-up appointment is. And we don't stop calling then. We continue to call every day until they get to that hospital follow-up appointment. That way, if they miss it, we're right there and can reschedule that, contact the agency, get them back in so there's no lapse in treatment. Every time we're talking with one of our patients, we're asking them about any suicidal thoughts, any thoughts of self-harm, and helping them use their crisis plan that they developed on the unit to process this. That crisis plan has coping skills, has ways of developing distractions and recognizing triggers so that they don't act on the suicidal thoughts that they may be having. One thing that I love about this program is that we are helping people feel connected at a time in our world where we are all feeling isolated. The computer is just not doing it. And so we've been sending cards, we call them caring cards, to our patients, every patient, not even just the high-risk patients who's discharged from our hospital, receives a caring card with an inspirational quote on it and a little note from their treatment team, the people who treated them in the hospital, so that they know we're not forgetting about you. We're here. We're here for you. And I just have to shout out for Calvin. He sent out hundreds of caring cards to our emergency room visitors, to our patients over this period of time, just working tirelessly, emailing me, Kate, I need more cards, and that's fantastic work. This is a service, and we need to identify the people who need this, who are at higher risk for suicide. That's key. Asking these important questions are key, and I will let Jennifer take it from here.
Thanks, Kate. That was an excellent review of our work so far with the Zero Suicide Initiative. Hi, everyone. I'm Jennifer Zaccardi Coulson. I'm the Chief Nurse Executive and Vice President for the Behavioral Health Service Line with Atrium Health. I did want to point out that one of the earlier educational opportunities we provided to our teammates, and I think we mentioned this last year, is motivational interviewing. The feedback we continue to receive is amazing. The objective of this class is to learn to listen more intently and assist our patients with decision-making around ambivalence. An example would be, I feel I should be dead. The clinician is equipped to focus on the decision-making process to assist the person in changing this behavior and their thinking pattern. It's a great class, and we continue to train our new teammates as they onboard in behavioral health. As Kate mentioned, asking the questions about suicide is vital in our work every day. We have had some major strides over the past year within Atrium Health and how we screen for suicide. I'm very happy to report that as of last year, April 2019, Atrium Health is now screening all emergency department, inpatient, and observation patients for suicidality using the Columbia Suicide Severity Rating Scale, otherwise known as the CSSRS or Columbia tool. The Columbia tool is an evidence-based screening process developed by Dr. Kelly Posner. She's the director of the Columbia Lighthouse Project. This quick and easy to use screening tool is widely used in the community. It's used by lay people, medic, schools, clinicians, and non-clinical folks. The website has a quick tutorial, but the bottom line is this: you ask the questions exactly as written. These are difficult questions to ask as it is, but so vital and important. By using this tool, we have somewhat alleviated the uncomfortable feeling someone may have by asking, have you actually had any thoughts of killing yourself? The Columbia screening tools are used for all age groups. We screen starting at age 6 and up. We continue to screen patients every 12 hours throughout their stay with us. We do this because we know that thoughts of suicide can be fleeting, and we do our best to constantly stay in tune with a patient's emotional well-being. Using this screening gets our teammates used to talking about suicide and making this topic less taboo. These tools work. We have saved lives since implementing. A part of our Zero Suicide plan is to keep track of data. I'm happy and proud to report that since implementation, acute care in Atrium Health has seen a reduction in suicides by 50%, and the Behavioral Health Service Line has achieved an 86% reduction in suicides since 2018. This is amazing work, and we are saving lives daily. You heard me say this last year, and I will say it again. Asking if someone wants to take their life should be our 5th vital sign. We check blood pressure, heart rate, etc. to ensure the heart and lungs are working properly. Let's start implementing that 5th vital sign about suicidality to check and see if the mind, spirit, and brain are working properly. I wanted to share some other exciting news. Just this month, and in honor of Suicide Prevention Month, Atrium Health installed 75 signs in various parking decks throughout our hospitals. These signs are located on all decks near the elevators. They have the National Suicide Hotline number posted on them. Ms. Fonda Bryant, community activist, spearheaded this project in Mecklenburg County. She solicits organizations around town to make them aware of the statistics of people dying by suicide from jumping off parking decks. She created these signs, and they are showing up all over town. Advocacy works. We thank you, Fonda, for caring. Those are my updates, and I appreciate you joining us today. Keep asking the questions. They work. You can and will save lives. Thank you.
Good afternoon. My name is Crystal Shirley, and I'm an instructor with Mental Health First Aid and a senior manager for the Behavioral Health Service Line. Mental Health First Aid is a full-day course where participants can learn about mental health disorders and a 5-step action plan on how to help someone experiencing a mental health crisis. Think of it kind of like CPR for mental health. In this program, we discuss myths and facts surrounding suicide and how to approach someone struggling with suicidal thoughts. One common myth is that asking a person about suicide will encourage them to attempt or possibly put the idea into their head, when in fact the opposite of this is true. Asking someone directly about their suicidal feelings will often lower their anxiety level and actually act as a deterrent. Your openness and concern in asking about suicide can actually serve as a shining light to that dark place, allowing them to openly share about their pain and allowing them to feel less lonely and less isolated. In the Mental Health First Aid Action course, participants learn how to confidently ask someone directly if they're having suicidal thoughts. These are questions not many people have ever asked in their lifetime, and it can be scary at first. However, in the class, we actually practice asking directly the questions, are you thinking about killing yourself, or are you thinking about suicide? If the person responds yes to either of these questions, the mental health first aider works with an individual to keep them safe, like calling the National Suicide Hotline or getting them immediately to safety, like driving them to the emergency room or calling mobile crisis. The beauty of mental health first aid is it doesn't take a licensed professional to recognize the signs and symptoms of a mental health crisis. Mental health first aiders can be the ones to make a difference in someone's life with suicidal thoughts. Keep in mind, your first aid action plans can be the first step in someone's journey to recovery.
We want you. We want your help. We want you to become a suicide prevention advocate in your community. And here are the tips to empower you. Remember to talk about suicide. We're just going over some things that we've said throughout the presentation, but bear repetition. It doesn't plant the thought in their head. It actually helps to reduce stigma when we're willing to talk about it and to help those that are struggling with it to share their thoughts and seek help. Ask someone if they're okay, and if they're not, ask them directly if they're thinking about suicide. Post about suicide prevention on social media. We need to normalize the conversation around suicide prevention in this country and in our community. Seek training in mental health first aid. Mental health first aid is an excellent course to help the layperson identify and respond to signs of suicide and mental illness. You can sign up at the address on your screen and call for help. If you or a loved one is struggling with suicidal thoughts, we have a team online 24 hours, 7 days a week at the Behavioral Health Helpline. These are licensed professionals who will take those calls at 704-444-2400 and are prepared to intervene immediately. I'm going to turn it over to Jerica now for our question and answer period for the webinar.
Thank you, Martha, and thank you to everyone who has submitted questions. Some great questions have come in. And I'm going to start with one for Dr. Rishal. Dr. Rishal, can you answer for us what impact the pandemic has had on suicide? Are suicide rates up?
We are definitely seeing, we're definitely seeing an increase in depression and anxiety. And we do believe that suicide rates are trending up as well. And it's going to take a little bit more time before we can really sit back and take a look at all the numbers. But given the stress that everybody's been under and the length of time that people have been under this stress, the fact that we're seeing more depression, anxiety, and substance abuse, as well as unfortunately domestic violence, none of that unfortunately is very surprising. And usually with that, after that occurs for a period, then you do see an increase in suicide rates as well.
Thank you, Dr. Rishal. Also, there was another question submitted that I believe Dr. Sparks can answer for us. How do you know if someone is seriously contemplating suicide? I know this is something you spoke to already, but maybe there's a number one sign, maybe an unusual one that you would like to point out again.
Sure. So the warning signs that I mentioned, those are all, I think, important to know. And I think it's important that for people to also know that the thinking about suicide and the stresses that are involved, it can be a complicated story. And sometimes it's bits and pieces of things that need to be all consolidated in and thinking about what may be going on with a person and how much at risk they are. Some of the bigger symptoms that I have seen and some of the concerns that I think people should be aware of is how people feel and look and report about hopelessness. It's hopelessness that really makes people not see a way out of the situation they're in, and it gives them, nothing to really to hang on to. That is a feeling that people have and that people can observe. The other that I always want to make sure about and that I mentioned is when people have access to lethal weapons, they can make a split somewhat of a decision to end their life when 2 minutes later they may not feel that way. And so the access to lethal means is absolutely the big concern that I always have when I'm seeing a patient. And so that's just one thing or two things, I guess, that I'd like for people to take away.
Thank you, Dr. Sparks. I also have a question I believe Dr. Villanueva can answer for us. How do you encourage a teenager who might be struggling with suicidal ideation? I think what they're looking for is maybe just some tips on how to speak to that particular age group.
Certainly. Whatever way you decide to talk to your teenager about suicide, it is going to be a very difficult conversation. However, a very necessary conversation and one that should not be delayed. So the first thing that I would say is speak to the teen without any judgment, without any invalidation of their feelings. So, for example, saying things like, well, this is just a phase, or look at all the good things you have, might not necessarily be very helpful. The person wants to be heard. So validate the teenager's feelings. Also, ask them directly, what's causing them to feel this way? What's causing them to think about suicide? Have there been any events, any stressors that have been going on that may be triggering this? I also think it's important to be very direct and also let your teenager know that you see that they're hurting. You see that they're struggling, that you see that they just feel miserable and that you are concerned about them. And emphasize that suicide is not really a great solution to what problems are happening right now, even though they are significant. And let your teenager know that you're there for them, that they're not alone, and that you're going to help them in whatever way that you can. And of course, if there is really concern that there's an imminent threat that your teenager is going to actually harm themselves, getting them to the help that they need. For example, any emergency room or the behavioral health Charlotte emergency room would be an appropriate intervention. But I would emphasize, be very non-judgmental and validate your teenager's feelings about their thoughts of suicide.
Thank you, Dr. Villanueva. We also got a question about if Zero Suicide has seen a decrease in rates since its initiation. Kate, is that something you can answer?
Sure, yes. We keep track of our patients when they're on the pathway, as we call it, and their visits back to our emergency rooms and their visits to our inpatient units. And we have seen a pretty significant decrease in those visits. We kind of monitor from prior to being on the pathway until they have been off of the pathway. And we've seen it's been about a 75% decrease in those visits. And I think, like I said, part of that is the connectedness, reaching out to them. And, you know, some people do live with chronic suicidal thoughts, and being able to be there and process those thoughts and utilize those coping skills that they've learned. They don't necessarily need to go back to the emergency room. If I'm available, I have a nurse that I work with, one of us can reach out to them. And of course, there's always our helpline that's 24/7 that Calvin had mentioned at the beginning. You know, we can alleviate them having to go back into an emergency room setting if at all possible.
Thank you, Kate. Next, I have a question for Jennifer, and it's a tough question, and we're sorry to hear about what happened. But they have a question about if we're working on decreasing our wait time within our emergency departments when people come in with suicidal ideation or possibly an attempt.
So thank you for your question. And unfortunately, this is a question that we often hear. We do have lengthier stays in our emergency departments because there are so many people that are needing our help right now and seeking care. All of our hospital beds are full for behavioral health patients, and we are treating and getting people back out in the community as fast as we can. Unfortunately, the need is greater than the amount of space that we have, so to speak. So we do have patients who are waiting for, you know, a day or a couple of days in emergency departments waiting. So we have developed some activities for patients to do while they're waiting for care. We do have a care team that you know, helps with the wait times. I know that this answer is not exactly what people want to hear, but we are doing our best to quickly pass that time. If there's anybody out there who has some ideas for us or to help with this, we're always willing to hear what you have to tell us. But again, I apologize for the wait that you and your loved one have had to experience, and we do actively try to decrease that wait time. So thank you.
Thank you, Jennifer. I also have another question I believe Kate could answer. If suicide is everyone's responsibility, is it your fault if you tried to stop someone and they succeeded at suicide and they ended up dying?
Absolutely not. You know, people are in so much pain that they feel like there's no alternative. So that's what, when Calvin was speaking and talking about how suicide affects everyone, and it can really impact anyone who has worked with or been close to someone who has died by suicide. And it's very important that you seek out help and treatment if you do go through something like that. If you have a patient or if you have a family member or a friend that you've tried to help, you've talked with them, and they still do take their life, that is something that can be very impactful and devastating. And I would definitely encourage you to reach out and speak with a counselor about that. It could be really helpful to just process that, but it is certainly not your fault.
Thank you, Kate. And I believe Martha would like to also add to Jennifer's answer about the wait times in our emergency departments.
Yes, I just wanted to add to Jennifer's response that while those patients are in our acute care emergency departments, they do see a psychiatrist with a telepsychiatry intervention. So those patients have access to a psychiatrist, and that psychiatrist does give recommendations to the emergency department about helping to manage that patient until they can get to the behavioral health hospital. So while it is not an ideal to have to wait for days to be transferred to an inpatient psychiatric hospital, there are interventions occurring with that patient while they're there in that acute care facility. Often it looks like a very uncomfortable situation because the rooms are stripped. We're trying to keep people safe. And so they remove objects from the room that the person could use to harm themselves. And that just makes a very difficult environment to wait in, but we are intervening with that patient. Our team is intervening with that patient and working with that acute care emergency room to initiate treatment as quickly as possible.
Thank you, Martha, for expanding on that. And next, I have a question for Dr. Rishal. Do you have any advice for those who have lost a loved one to suicide?
Certainly, that's one of the most difficult things people can go through, is losing a loved one to suicide. And really, a lot of times, it's not as much advice for the people that have lost someone, because really they need time. They need time to sort through things and have an opportunity to kind of reflect. But I also, when I think about what they need, they still need support from other people. A lot of times when somebody loses someone to suicide, their friends and family really don't know what to say or what to do. And it manifests itself in different ways. A lot of times they're afraid because they don't know what to say, because a friend doesn't know what to say to somebody that's lost someone to suicide. They just stay away. They don't contact that person. And for a person going through a loss like that, that can be the worst thing you can do. Certainly, if somebody says, "Hey, I need some time," it's okay to give them that space, but maybe then check back in with them and see how they're doing. The other thing I see a lot of times from people that know people that have lost people to suicide is because it's such an uncomfortable situation, it makes them angry, and a lot of times they do and say things that I don't think they mean, but can be quite harsh. So when somebody's going through a loss like that, I would say don't judge what they do. They may do 100 different things in how they deal with it, whether it's staying by themselves and crying, whether it's wanting to talk about it, whether it's writing. I've seen mothers that have lost children to suicide write editorials to newspapers discussing that loss. And then I've seen people actually then almost scold those people in the chat boxes. So, but really this is just their way of trying to make sense out of what happened, and also their way and I think sometimes their way to prevent other people from going through the same thing, and so therefore giving the death of their loved one meaning. If you are going through a loss, like I said, give yourself some time. And it's certainly to have dysphoric feelings is certainly something that's associated with losing someone to suicide. Sleeping more, sleeping less, those are things you're going to experience too, unfortunately. Feelings of anxiety, not eating as much as you used to, and sometimes not feeling like you want to go out and do the things that you typically do can also be associated. with that. However, if you start noticing suicidal thoughts yourself, which unfortunately a lot of times accompanies this, that's not normal, and that's definitely an indication for you to get help. Also, if it gets to the point where you're not able to take care of yourself, whether it's not being able to get out of bed at all in the morning, or not being able to go to work at all, those are or isolating to the point where you don't see anybody for long lengths of time. Those are all indications that you need to seek help yourself to try to manage some of those feelings, because those are warning signs.
Thank you, Dr. Rishal. And next I have a question for Jennifer, and it's about if we have resources available for Atrium Health teammates who might be struggling.
That is a great question, and thank you for asking. Yes, we absolutely have resources for you. First and foremost, I would like to again repeat the Behavioral Health Call Center number. That's 704-444-2400. That is a 24-hour behavioral health call center. It is staffed with master's level clinicians, and we will absolutely answer your call and we will talk to you immediately. Also would like to remind teammates about our employee assistance program. That is a service that is a benefit that we have as a teammate working through Atrium Health. It's a wonderful service. Please reach out to EAP. That number, we can list it in the chat box for you to get an appointment with a therapist there. We have a full continuum of services through our behavioral health service line. So we have virtual services, we have in-person services, we have outpatient services. You can get in to see a psychiatrist if medications are needed. We have a full variety of different types of therapists who can help you during this time of struggle. But I want to reiterate with everybody who's listening to us, there is hope. We have help for you. We just need you to pick up the phone and call us. We are here for you, and we promise you we will get you through this crisis of yours. We're all dealing with this in all different kinds of ways, whether we're out there walking, doing some healthy things. We may be indulging in some unhealthy behaviors, drinking, using substances. And the most extreme thing would be to consider taking your life. So again, I want to reiterate, we are here for you. Just pick up the phone and call us. I hope that answered the question. Thank you.
Definitely. Thank you, Jennifer. And I'll make sure to get that employee assistance program phone number in the chat box, like you mentioned. There's another question that I think Dr. Villanueva can answer for us, and this will be the last question so that we can wrap things up on time. Thank you to everyone for submitting these questions. I'm sorry we couldn't get to all of them, but this is a great conversation. Dr. Villanueva, someone messaged in that my grandson lost his mom. How do I deal with the sad moods that he gets in? Because he says that he wants to talk to someone besides me because he says I don't understand.
I think that, again, if you're being very kind of accepting of this individual's, if your grandson's pain, and it sounds like you are, I think it's also important to say, okay, if you want to talk to somebody else, if you want to talk to somebody that you think that can help you, perfectly reasonable to say, let me help you find somebody. And it doesn't mean that your grandson doesn't want to talk to you, that they may feel that they would feel more comfortable talking to someone who might be more objective. It doesn't mean that they don't trust you. But it's important to know the resources, and people have been talking about what are the resources in the community for mental health, to know how to get grandson to the care that they need. But I think just being very validating and recognizing the needs that he has at this time is important.
Thank you, Dr. Villanueva. And I'll go ahead and toss it back to Martha to close us out. Thank you.
So please reach out to our team after today's event if you would like more information or you have further questions. Any of us are available to help you. If you're in crisis or you know someone who is, please call the number that's on your screen. The Behavioral Health Helpline, 704-444-2400. Again, 24 hours a day, 7 days a week, someone is there to answer the phone and to respond to your crisis. Remember that reaching out to someone who has thoughts of completing suicide is one way of honoring our Atrium Health mission. Hope, health, and healing for all. Thank you again for joining us today.